Rhodiola rosea, also known as golden root, is an adaptogen herb with tremendous fat-burning, energy-enhancing, and brain-boosting power. It is also favorable for proper thyroid functioning, cancer treatment, fighting depression, anxiety, and subsequent disorders. Rhodiola rosea is a flowering herb that grows in cold, high-altitude regions of Europe and Asia. Other names for it include Arctic root, golden root, king's crown, and rose root. Hey everyone, I'm Ashley, and welcome to Nature-Based Medicines. Today I'm going to share the benefits of Rhodiola rosea and its side effects. Before we get started, make sure to hit that subscribe button and the notification bell, so you won't miss any future videos about nature-based medicines and herbs. What is Rhodiola rosea? Rhodiola rosea is a perennial flowering plant in the family Crassulaceae. It is highly profitable as it serves to amp our energy and reduces stress and other disorders. These plants can be easily identified by several stems growing from the same root, topped by small yellowish-white flowers, and the plants commonly grow in cliffs or rocky sea regions. Rhodiola rosea has been used in traditional medicine for many years, particularly in Russia, Scandinavia, and other cold, mountainous areas. Some people believe the herb can treat anxiety, depression, fatigue, anemia, and headaches. Numerous studies have been conducted on the plant. While some results appear promising, many of the studies have been small, biased, or flawed. As such, experts say more research needs to be done to determine how Rhodiola rosea is effective and whether it should be included in treatment plans. Meanwhile, Rhodiola rosea has a low risk of side effects and appears to offer some benefits for many of these conditions. Therefore, it may be a natural option that is worth trying for its supposed uses. Nutritional value of Rhodiola rosea. Rhodiola roots contain an increased proportion of organic compounds like phenols, rosavin, rosin, rosarin, organic acids, terpenoids, phenol carbonic acids and their derivatives, flavonoids, anthraquinones, and alkaloids. Rhodiola benefits have been used extensively for improving work performance, insomnia, fatigue, depression, and increasing athletic endurance. Health benefits of Rhodiola rosea. As mentioned here are the best health benefits of Rhodiola rosea. 1. Beat depression and improve brain function. Rhodiola extracts facilitate the transport of serotonin precursors, tryptophan, and 5-hydroxytryptophan into the brain. It can thus act effectively as an antidepressant. Rhodiola rosea tea can be extremely effective for curing depression. Some of the organic compounds in this herb are considered adaptogenic, meaning that these act to cure depression completely. 2. Memory boost. Rhodiola rosea enhances memorization capabilities and concentration ability over prolonged periods. It increases the bioelectrical activity of the brain, which enhances memory and brain energy. Rhodiola increases the sensitivity of neurons, including two neurotransmitters serotonin and dopamine. These two neurotransmitters are highly beneficial for increasing focus, memory, and pleasure, and improving mood. 3. Cancer prevention. The high concentration of antioxidants found in the roots of Rhodiola rosea aids in the body's natural resistance to toxins. It can be helpful in preventing and treating certain types of cancer. Anti-tumor activity is just as vital as antioxidant effects, and this herb boasts both of these. Rhodiola rosea has been found highly effective, particularly for bladder cancer. 4. Energy boost. Rhodiola can increase stamina and endurance by increasing red blood cell count of our body. Red blood cells, RBC, carry oxygen to muscles, and a large number of RBC can enhance an athlete's performance and delay fatigue. Rhodiola benefits work by boosting erythropoietin, EPO, which stimulates RBC production. Rhodiola has played important roles in increasing metabolism and stimulating greater circulation of blood and oxygen within the body. 5. Stress relief. The chemical constituents present in Rhodiola rosea can positively affect the hormonal levels of the body and induce relaxation. It is considered a potent adaptogen that allows our physiology to handle stressful situations in a more resourceful manner. Rhodiola can be used as a therapy in asthenic conditions, decline in work performance, sleep disturbances, poor appetite, irritability, hypertension, headaches, and fatigue, developing due to excessive physical or intellectual strain, influenza and other viral exposures, and other illnesses. 6. Cardiac problems. Rhodiola is also effective in boosting cardiac functioning. It helps to decrease the amount of catecholamines and corticosteroids that are released by the adrenal glands during stress. These stress hormones subsequently raise blood pressure, cholesterol, and potassium levels and increase risk factors for heart disease. Rhodiola has been found to lower unwanted harmful blood lipids and thus prevent heart diseases. It also decreases the amount of cyclic AMP, cAMP, released into cardiac cells. It assists in the uptake of more intracellular calcium into the heart and thus promotes a greater potential for heart muscle contraction, regulating the heartbeat and counteracting heart arrhythmias. 7. Immune system. Rhodiola stimulates and enhances the immune system by reinstating homeostasis, metabolic balance, in the body. It also escalates the natural killer cells, NK, in the stomach and spleen. This action is possible because of its ability to normalize hormones by controlling the release of glucocorticoids into the body. 8. Sexual health. Rhodiola rosea has substantially improved erectile dysfunction and premature ejaculation. It also normalizes their prostatic fluid. This can lead to increased fertility, boosted libido, and a generally healthier sex life. 9. Weight loss efforts. Rhodiola rosea extracts and teas are beneficial for weight loss efforts. The release of greater quantity of adipose tissue is one of the keys to losing weight, and Rhodiola rosea speeds up the fat-burning cells in our body when coupled with exercises. Thus, extracts of this can help in weight loss. Uses of Rhodiola rosea. Rhodiola is highly effective in burning belly fat by activating the lipolytic processes, fat breakdown, and mobilizing lipids from adipose tissue. It also improves hearing, regulates blood sugar levels for diabetics, and protects the liver from environmental toxins. It can also clinically enhance thyroid function without causing hyperthyroidism, thymus gland function, and delay involution that occurs with aging. It can also ameliorate adrenal gland reserves without causing hypertrophy. How to take it. Like many herbs, Rhodiola rosea is available in the form of capsules, tablets, dried powder, and liquid extract. The dosage and amount of extract varies between brands and product types. Herbs and supplements are regulated as food, not drugs, by the United States Food and Drug Administration, FDA. As a result, knowing what dose to take and how much is included in the product is not always clear. There may also be issues with quality or purity. Although some studies have listed dosages used for specific purposes, it appears that the herb may be taken at different strengths to treat different problems. In the Alternative Medicine Review article, the author says the dosage may vary, depending on how much standardized extract it contains. Rosavin, in particular, is one of the compounds named as having an effect on reducing stress. The author of the review suggests approximately 360 to 600 mg daily of an extract standardized for 1% Rosavin. 180 to 300 mg of an extract standardized for 2% Rosavin. 100 to 170 mg for an extract standardized for 3.6% Rosavin. Risks and side effects. Allergies of Rhodiola rosea. Though its therapeutic effects have yet to be proven, the studies on Rhodiola rosea all seem to agree that any side effects are mild. Side effects have included: the side effects of using Rhodiola rosea for a prolonged time are insomnia, irritability, chest tightness, and increased blood pressure. Apart from this, a person can experience dizziness, dry mouth, sleep problems, and jitteriness. Jitteriness is a particular problem among those prone to anxiety who take higher doses of the supplement. As it has a mild stimulant-type effect, Rhodiola rosea is not recommended for people who have bipolar disorder or who are taking other stimulants. One article suggests that people can take the herb on an empty stomach 30 minutes before breakfast and lunch. Avoiding it in the evening may help reduce sleep problems at night. Takeaway: Rhodiola rosea has a long tradition of being used to help increase stamina, concentration, and mental well-being. Large, valid studies on these effects are lacking. However, the herb's low risk of side effects makes it an attractive option for people looking to improve their health in these specific areas. As with any supplement, it is best for people to speak with a doctor before taking it. Problems such as fatigue and trouble concentrating can sometimes be symptoms of an underlying health condition that needs treatment. Likewise, depression and anxiety can be serious mental health conditions that require the care of a doctor. Thank you for watching, and be sure to subscribe, because more incredible content is on the way. If you found this video helpful for you, don't forget to give it a thumbs up and share it with others who might benefit from this information. And also let us know in the comments below if you have any additional benefits.